Norwich. Find out why you'll buy better at Burns.
You buy better.
Better at Burns.
Much better.
So much better at Burns. The right insurance at the right price. You buy better at Burns.
You buy better at Burns. You buy better.
Hurricane season is upon us. Did you know insurance companies can issue moratoriums that prevent you from securing coverage when there's an impending storm? Homeowners, business owners, property owners, act now. Don't let your coverage leave you out in the rain. The licensed professionals at the Burns Agency are here to help. Call, email, or chat with us online today. Don't let the next natural disaster become an insurance disaster. The Burns Agency, proudly serving Eastern Connecticut since 1932.
Better.
Better at Burns.
Much better.
So much better at Burns. The right insurance at the right price. You buy better at Burns.
You buy better at Burns. You buy better.
This is a news update from the Streaming News and Sports Programming Network, SNSN. Governor Ned Lamont announced that as the Connecticut General Assembly has given final legislative approval to renew the COVID-19 civil preparedness and public health emergency declarations now through February 15th, 2022. He has signed an executive order authorizing 9 previously issued executive orders to remain in effect through the duration of the renewed declarations and revising and narrowing 2 previously issued executive orders. You can go to the SNSN news page on Facebook for a complete report on Governor Lamont extending his executive powers through February 15th. So now we know, due to the executive orders, all teachers in the state of Connecticut needed to have at least one shot of the vaccine by September 27th. However, not the case for a Wallingford high school teacher who has been placed on leave for refusing to get the COVID-19 vaccine or to submit to weekly testing. Kashim Outlaw said when the district-wide vaccine mandate went into effect, he refused and he was asked to leave the building due to non-compliance. He is now on unpaid administrative leave. As a public service, we want to let you know that there is free drive-through COVID-19 testing that's at Dodd Stadium, 14 Stott Avenue in Norwich. They will be doing it Monday, Tuesday, Thursday, and Friday from 3 to 7 p.m. And UCFS here in Griswold, 226 East Main Street, will be doing testing on Saturday, 7 to 11 a.m. There is no appointment needed, although patients will be asked for insurance confirmation. There is no cost or out-of-pocket expense for a COVID test at any of the state-sponsored locations.
The 8:30 a.m. report has been brought to you by the Burns Agency. With offices in Dayville and Norwich, find out why you'll buy better at Burns.
All right, time to take a look at the forecast right now for Eastern Connecticut and beyond.
Beyond, huh?
Yeah, I don't know.
Anyway, right now the temperature downtown.
I didn't even get a chance to introduce you.
That's okay.
No, here he is, Paul Lash.
All right, here I am. Right now the temperature downtown city, 50 degrees. Sunshine to start today. A few afternoon clouds. Highs will be somewhere around 66 degrees. A little wind, 5 to 10 miles per hour. But tonight, well, lows will be around 46 with partly cloudy skies. And of course, for your Thursday, well, intervals of clouds and sunshines. Highs about 61. Again, the wind will continue to blow 5 to 10 miles per hour. And of course, for Thursday evening, mainly clear. Lows around 40. So yeah, frost is going to go down that pumpkin. Anyway, that's your weather from SNSN on this Wednesday, 09/29/2021.
There are 2 types of traffic control devices that require drivers to come to a complete stop before proceeding forward: red lights and stop signs. According to statistics published by the National Highways Traffic Safety Administration, an average of 2 people die each day in the United States in automobile collisions caused by someone running a red light, and over 120,000 are injured. 45% of all crashes occur at intersections where someone often has a stop sign or red light and fails to stop and or yield the right of way after stopping. When the driver fails to stop for a traffic control device, the results can be deadly, particularly if they are rushing to beat a yellow light. Failing to stop constitutes negligence on the part of the vehicle operator. The following has been brought to you by Griswold Health and Safety.
News and information you need for your day. SNSN.
All right, so we got rid of the rhetoric there.
Yeah, you did.
So you did that little PSA, did you not?
Yeah, quite a while ago.
Yeah.
Well, we got
Still reigns supreme. Speaking of reigning supreme, what's up, Dad? Ned Lamont again extending his executive orders through February 15th.
I don't understand why that had to be done. I really don't. I mean, I heard on the news this morning, we're up over 70 something percent. I think maybe 75% of people who have been vaccinated in this state. Okay. I mean, that's pretty high. I think we're one of the highest states in the country as far as vaccinations go. In most of the states around us are pretty green as far as vaccinations go. So why does he have to have these special powers? I mean, what's he going to do?
I don't understand this one.
What the hell is he want? I mean, I can see if we were in trouble.
Yeah,
but we're not.
We're not Australia.
Oh, Australia.
So yeah, I don't get it. I mean, I have not seen nor talked to anybody that feels that he should have extended it again.
No, he just wants to be King Ned. Well, I hope people remember this next time in November comes around when he's up for election, because there's no need of that.
Yeah, I don't okay. When it began,
yes, I can understand.
Through like, the time that it did. Okay, even this last time, it was like, oh, well, all right.
Yeah,
because there was always that concern of well, is it going to start spreading again?
Correct.
But it's pretty much stayed at bay, for a little bit. However, devil's advocate, it was the same thing last year too. It was at bay for a while, and all of a sudden, October, November, December, infections started to go way up again.
Yeah,
but these are good questions that we can ask Patrick McCormack when he comes in.
Correct.
A little bit after 9:00 this morning. So
you also keep in mind too that last year at this time there really wasn't a lot of vaccinations going on. There weren't any. Really.
Right.
Now we have a lot of people vaccinated, so the level of sickness, if you get it, is not going to be to the level as it was before. It's no different than getting the flu. So, I mean, we're in a lot better position than we were a year ago. So, I don't understand why.
Well, I think so too.
I don't understand why this guy.
People are still getting it.
Yeah.
People are still getting COVID-19. People are still going to the hospital.
Yeah.
What was the reported rate yesterday? 2.82.
Yeah, it was down.
Well, actually, it was up a little bit because it was like 2.2, 2.3.
Yeah, but the number of cases are down.
Yeah, well, yeah, it is. Yeah. And hospitalizations are down too.
Yeah.
So.
Well, as more and more people get vaccinated, it's definitely going to bring the hospitalizations down.
Right.
We would hope. I mean, that's what you get vaccinated for.
Well, that is the hope.
Yeah.
That is definitely the hope. So.
Yeah.
So we'll have to wait and see how this folds out. And I mean, those are good questions for Patrick.
Yeah, I wonder how we feel. Why do we have to have a governor take us over?
I don't think asking him how he feels about it personally, because I don't think he's going to go there.
Yeah, probably a bump.
I think this is strictly a business question, and
Well, I think one of the most important questions you need to ask him is how's Griswold doing. I mean, we're more interested in how it is around here.
Well, you know that.
I know that.
Chairman of the Health and Safety Committee, King Paul.
But I think it's good that we know what's going on around here, and if we have a level that's kind of high, I think it should be expressed to the people so that they know that. I mean, come on. But we're more interested, and I think the good thing about it is that we're not mandatory to do anything like other states and other towns, and other countries.
So Jim Barney sent me a news story a few days ago.
Mm-hmm.
I think it was Monday night.
Yeah.
He sent it. You always know Jim's up when he's sending an email at 2:00 in the morning.
Yeah, I know.
And this is something that I want to go more in depth with him because we talked about it a little bit yesterday.
Yeah.
You know, the state of what they are in Australia
Oh, yeah.
compared to what they are here.
Yeah.
And we complain.
You should see those poor people, what they're going through. I was told you off, off, can't say
What's that?
camera, but off mic that
Yeah.
I watched a couple of videos that when I got through, I was so PO'd at what was going on. I mean, the poor guy was walking down the street, he's wearing the mask, but he was smoking a cigarette. He pulled his mask down to smoke a cigarette. 6 cops jumped him, knocked him to the ground like he was a criminal, handcuffed him. And all he was doing was smoking a cigarette. I saw another young woman who was next to a building. I'm not sure exactly what she was doing, but she didn't have a mask on. A cop came up to him, put his hand around her throat, pushed her up against the wall.
Yeah.
I mean, if that was happening in here, it would be brutality by the freaking cops. These are not criminals. I was so ticked off. And the prime minister one is enforcing this.
Yeah.
To do this. I mean,
It's a terrible state of affairs.
I mean, people in Australia, I mean, if I was over there, I'd really be PO.
Do you think that'll happen here?
I don't think so.
I don't think so either.
I don't think so.
I don't think so.
Because right now, a lot of people are not happy with our government at all. They're not happy with the White House. I mean, let's face it, the White House, the popularity of the White House is so down now. It's like unbelievable. And I don't think it'll happen here. And I gotta applaud a local legislatures here, or also our people who are elected officials who are not enforcing that, leaving it up to the business, which is good. So, but I'm sure other states, you don't know what other states are going to do.
So that phone call I got about at 8:08 this morning.
Got another one?
Same person.
Oh yeah,
same person. I'm like, all right, dude. If I didn't answer it at 8:08,
yeah,
at 8:39, it probably not going to answer it either.
Yeah.
Yeah. Means I'll call you when I can.
Yeah.
They're definitely persistent.
Tell me about it. I mean,
Definitely
they tell
persistent.
you when you get these warranty calls, press number 8 to get out of it. You know how many times I press number 8 and I still get calls.
Well, you know what it is that, and this is how they circumvent it. So let's say somebody calls you from 867-5309.
Yeah.
Okay. And they
Sounds
say
like a song.
it is, but they said, so, I'd like to talk to you about your car's extended warranty, blah, 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 blah. Press 8 to get out.
Yeah.
Well, okay, boom. So you do that. But then they just call you from another number.
I know. Yeah.
Because they have blocks of phone numbers.
Yeah. I mean, and the other thing
So blame the damn phone company because they're the ones that are selling the blocks of phone numbers to
and they
these
don't
people.
care. They don't know who to sell to. And the other thing, too, is a lot of these robocalls come in with a local number.
Yeah.
It'll be 860-376.
Yeah.
It'll be some numbers. So so you must be somebody looking for me because they're in town, right?
Right.
It's one of those stupid calls.
Yeah.
Yeah. So.
I'd like to talk to you about your car's extended warranty.
Oh, yeah.
Or and I want to talk to you right now about I am an IRS agent.
Oh, yeah.
That's another one right
There
now.
hasn't been too much around for that one lately.
And they're targeting the senior community.
Oh, yeah.
On that one, yeah.
Yeah.
So here's the thing. If you're getting a call from somebody saying, well, you need to send this, or this to get out of this IRS situation
Yeah.
or whatever it is, and they tell you, yes, send Kohl's gift cards.
Yeah.
And if you send Kohl's gift cards thinking, this is going to remedy the issue, well, then you know what? You deserved it. Because I don't know anybody, that said, oh, by the way, you can pay this bill right now by just send me a Walmart gift card. There will be good. I don't know anybody that's ever done that. Any company that's legit that does that.
Well, we know somebody that sent a lot of money to
Africa.
One of those companies. I mean, yeah, they did. Unfortunately, the person, it was eventually caught up to where they stopped it. I mean, unfortunately, some money had gone through. It was too late, but they stopped it from happening again.
It was Trooper McCarthy, wasn't it? That had to do with that. And it was also Kimmy from two sisters that was in on that. Well, they were in on one.
Yeah.
Where it was an older woman, and they prey on older women.
Oh, actually, though.
Come in and they make you feel like loved and all this, and they can't live without you, and next thing you know, they're saying, can you send me this? Next thing you know, you're sending money to these people.
Yeah.
And
It's scary what they're doing today.
Yeah.
And unfortunately, a lot of older folks are not familiar with technology, so they believe everything. Everything that somebody tells them, they believe. So, but anyway,
and I think that's why they target the elderly community, because they may not be as privy to the knowledge of electronics, computers, phones, that kind of stuff.
Yeah. And they don't really care. They don't really care about learning about it either. I mean, what for?
Yeah.
So, but
you know what I want to know? We're talking about, I don't care. I want to know what people in town want to talk about.
Oh.
I mean, do they think we're going to sit here and pole dance? Is that the entertainment we're looking for on a Wednesday morning?
No. But
we would like to know what it is you'd like to converse about.
Right.
Tell us, and then we can go ahead and make sure we get that content for you.
Hey, oh my God, there he is.
Yeah, look at that. Look at the cat just dragged.
I know it. He's all masked up too.
Yeah. Well, it's okay.
Yeah. Unfortunately, I don't have one with me.
Huh?
You want to go out there? Come on in here.
Oh yeah, of course,
okay.
Sure.
Cost a dime.
Let's leave it on the back. Leave it on the sink.
I probably should move over there. That way, when Todd comes in, the two of them could be here.
Okay.
Yeah.
So yeah, I mean, it would. I would like to know what you guys want to talk about.
Yeah.
I mean, we can talk about anything. We can bring guests in for just about anything.
I know.
But to kind of sit here and guess all day long, tell us what you guys want to talk about. Tell us what you guys want to
exactly.
What kind of subject matter. Who do you want us to bring in, so you can go ahead and get some information or some entertainment or whatever. But we got to know from you.
Yeah.
If you don't tell us,
we don't know.
Yeah.
Yeah. Well, by the way, today is National Coffee Day.
It is.
Yes. Just so you didn't know.
And I got a cup here. Hello, gorgeous. It says hello, gorgeous.
Yeah. They gave you that cup by mistake.
Shut up. Patrick McCormack will be joining us in a couple of minutes from Uncas Health District, as well as Todd Babbitt, the first selectman here in Griswold. And we're going to go ahead and talk about COVID-19, public safety. Paul Lash, who just happens to be the chairman of the Griswold Health and Safety Commission here in town. So yeah.
Well, we kind of talked.
What's that?
They talked about coming in and talking about COVID because of some of the increases in town. So I thought it was a good idea to bring them in to let people be aware of what's happening in the town of Griswold.
All right, we're going to take a quick break, and in a couple of minutes, we'll be joined by Patrick McCormack from Uncas Health, right here on SNSN.
You buy better.
Better it burns.
Much better.
So much better it burns. The right insurance at the right price. You buy better it burns.
You buy better. You buy better.
Hurricane season is upon us. Did you know insurance companies can issue moratoriums that prevent you from securing coverage when there's an impending storm? Homeowners, business owners, property owners, act now. Don't let your coverage leave you out in the rain. The licensed professionals at the Burns Agency are here to help. Call, email, or chat with us online today. Don't let the next natural disaster become an insurance disaster. The Burns Agency, proudly serving Eastern Connecticut since 1932.
Better.
Better it burns.
Much better.
So much better it burns. The right insurance at the right price. You buy better better, it burns.
You buy better, it burns. You buy better.
Hey, I'm Jess, but you can call me the Tire Queen. For the best deals on tires, come and see me at Advanced Automotive on Route 138 in Griswold. Call me at 860-376-8687. But definitely don't talk to my dad. He's definitely not the Tire King.
And right now, Jess the Tire Queen has great deals and excellent service waiting for you at Advanced Automotive, Route 138, Griswold.
Hello, I'm Miranda Mahoney, Project Coordinator of Griswold Pride, your drug-free community coalition. We want to help you keep your kids safe during this challenging time. Social distancing is still in effect, and so is the social hose law. Reports are coming in that teens are contracting the virus at underage drinking parties. Parents, allowing underage drinking on your property could land you in jail for up to a year, plus fines. Another reason why you should not provide alcohol to our youth. For more info, go to griswoldpride.org. griswoldpride.org. griswoldpride.org.
Here's a look at your local weather forecast on SNSN. Well, after the rain passes from yesterday, we should have a better day today, weather-wise. Sunny skies. Temperatures comfortable, right around 65 degrees. For tonight, a 20% chance of showers after 2 a.m. Partly cloudy, temps chilly down to 48. And for Thursday, 20% chance of showers, but partly sunny skies with temperatures right around 63 degrees.
Your news and information source, SNSN.
All right, good morning. Welcome back to the show. Once again, we've been kind of singing the praises of, tell us what you want to talk about, folks. Because we don't know.
Yeah.
We don't know
Raises.
whatsoever.
Yeah, just lift it up for him. Yeah.
You're tall.
I know. I've been growing.
God,
Eating my vegetables.
God. It's Patrick McCormack. Now, you can't see Paul because he's off camera right now.
Yeah. Well,
So
that's
we're going to make
Todd-
way for Todd
that's
Babbitt
for
when
Todd.
he comes in.
Yeah.
Todd will be in a few minutes. So don't really want to get into too much as far as Griswold is concerned. Figured, right now, because we could wait for Todd for that.
Yeah.
But one of the questions I've had really for the last 2 years, I don't know if I've really asked you this or not,
Sure.
is all of the directives that comes from Uncas Health, is it really all just coming from the state, or does Uncas Health have their own initiatives that they're doing that say maybe Ledge Light's not doing, or say Northeast District Department of Health?
So my goal from the beginning has been to be consistent. I think that's been our ask of the state is consistency.
And you've said
is better.
that. You've said that.
Yeah. I mean, that's been the problem from day one is when they create these local opportunities for people to create their own laws and statutes and regulations, et cetera, then it confuses people. And we said that when they decided that they were going to have local towns decide on a mask mandate. I said, you can't be driving from Norwich where you go shopping, and then you drive through Preston and you get gas, and then you drive up to Griswold to go golfing, and then you're going to go to Plainfield to do something else, and you have a different requirement. I said, the public doesn't know. They don't know where to get the information. They don't know if it's going to be enforced or not. I had a pizza place tell me, he said, look, my employees want everybody to be masked because they're here all day long and they want to be safe. He said, but I've got customers who are giving me a hard time saying they don't want to wear masks and they're not going to take their business to my place anymore if I make them wear masks.
Too, yeah.
He said, and then I don't know if you guys are going to come in or somebody else is going to come in and write me a fine if people aren't wearing the mask. So he says, I don't want to get fined either, but he says, I got to run a business. So what am I supposed to do? So that's been the type of thing we're hearing from people is, look, if it's across the board the same, people accept it because they know it's the same everywhere. But when people can say, I'm going to take my business from Griswold to Plainfield, or I'm going to take my business from Griswold to Lisbon because they're doing something different, it shouldn't be based on a business decision. It should be based on good public health decision making.
But isn't that kind of what's going on right now with Norwich and, say, Griswold? Because does Norwich have a mask mandate?
So I had a health director yesterday send me an email and said, can you tell me which towns that you serve have a mask mandate? And he sent it to 5 or 6 different health directors. And I had a couple say, well, I know it's in this town. I'm checking to see if it's in this one. And so even, it can be difficult for us, and we don't create the mask mandates for the towns. It falls on the, city manager or the town, whatever. So just trying to find that information and find it in an accurate place. So for us, I know we have one in Norwich, we have one in Salem, and we have one in Franklin.
See, I didn't know about Salem or Franklin.
Yeah.
Yeah.
I knew about Norwich.
Yeah.
And the
I
only,
was in Norwich yesterday. I went and got a haircut, and I
Yeah.
had to wear a mask while I was getting a haircut.
Yeah.
My wife was next town over. She went and got her hair done, no mask.
Right. And, I think it comes down to, is it enforceable? I heard one of the first selectmen in one of the towns in southern part of the county said, look, I talked to my police department. They don't have the staff to be able to manage it. Things are reopened now, so they have to focus on other things.
Right.
He said, if I'm not going to be able to enforce it, then I don't want to do it.
Well,
And
that was
others-
one thing that Tom Sparkman said when
Yeah.
he came here.
Mhm.
He had said, like, how do you enforce a mask mandate?
Right.
Somebody calls you from Walmart and says, excuse me, can you send the police down here because there are 4 people that are not wearing masks
Right.
and we have a mask mandate, yet you got somebody robbing a bank.
Right. But then you had, some first selectmen said, but if 70 or 80% of the people follow it, then I at least feel like I've done something to encourage people and educate them. I had a church the other day call me and said it's actually really good because it gives us some ability to emphasize what we already want them to do anyway. So he said, now we can just say, look, the city's requiring it. There's nothing we can do. And it takes it off of them, the stress of having to enforce it. So everybody sees it differently. I say, the safety part is what I'm really interested in. I've got one on today.
Yeah.
We had a period of time, you remember back in June when the numbers were 0 for hospitalizations in the county, that the numbers were really low in terms of cases.
Yep.
And then it went back up. So there was a point when we thought people are going to be taking their masks off, things started reopening, and then all of a sudden people became more cautious again. So we've kind of had that ebb and flow. And we understand that. So we're just trying to be consistent across the board for people. So the answer to your question in my long-winded way is no, we don't have a specific rule or requirement that comes out of the district. We provide the guidance and we do it. And that's why we sit in on 3, 4, 5 meetings a day, is trying to make sure we have the most up to date. So we give you the right information. It's hard enough for us. So I know it's going to be hard for the public and for business owners. So we try to share it as best we can.
We certainly don't want to be like Australia.
I like Australia. There's
I
nothing wrong with being like Australia.
like Australia
They have
too,
great
but,
shrimp and
but if
everything
you were
else.
walking in Australia, you have a mask on, they're going to kick your ass. That's exactly what's going to
There's
happen.
too many things in Australia as far as animals that'll kill you. Now they're talking about the government killing you.
I know it.
So
It's
I
like
mean,
unbelievable what they're doing. You talk about police. I mean, they're really beating up on people because they don't have a mask on.
Yeah.
let me ask you a question: Is some of that propaganda?
I don't know. They look like real.
Come on,
real-
like and I know. Okay, the entire country of Iran, isn't just a bunch of, tormented souls.
Yeah.
They're not. They're
Yeah.
they're very peaceful people.
But
There's some people that are not.
But my take from the beginning has been, look, civility has to rule out through all of this. And, I had people say, well, it's pandemic fatigue. It's pandemic fatigue. And I said, I think it's rule fatigue. Honestly, I think, you see people driving down the road lately. Nobody seems to be wanting to follow the rules. Everybody's complaining about any rule that's enforced.
Yes.
And I think they're just tired of it. For there was such a long period of time, you couldn't go anywhere. You couldn't do anything.
Right.
And now people are saying, now I'm going to open up and do whatever I want. And you can't tell me any different. So I just, I think civility has to be the way that we have to encourage people.
Yeah.
Understand that everybody's trying to do the best they can to get through this and just be patient with one another.
Right.
All right, we're joined by Todd Babbitt. I moved it over there so people could see you.
Oh, sorry about that. I was trying to get my distance here.
Well, that's why I moved his back a little bit.
His arm is 6 feet long, if you don't know.
So
Yours is only 3.5 feet.
that's
so it
like
doesn't count.
wingspan, right?
Yeah.
Okay. So I do want to ask this. You both you gentlemen came in wearing masks today. So do you do that because you feel unsafe here, or you just feel that you feel unsafe anywhere right now?
So from my perspective, number one is
Because we're both fully vaccinated.
right, and as am I. And
I am too.
part of it is I want to make sure that people recognize that there's still a potential for somebody to either pass the illness or become sick. So I think part of it is setting the example. Part of it is showing that it's not, again, it's that civility thing and that trying to demonstrate thing. It's not a lot for me to have to put the mask on. And if I'm making somebody else feel more comfortable by doing it, that helps as well. But I think it's an extra level of safety. We talk about on every meeting we're on about mitigation strategies. So you talk about all the different things you can do to keep yourself safer, have events outdoors, wear a mask when you're indoors. keeping some distance between people. If you can get vaccinated, I mean, that's really the goal for people, is to consider vaccination. It's been the best thing. We heard today that I think it's 25% of the people getting sick now are those under the age of 12 who can't get vaccinated. So again, it shows that the vaccination works if you get it.
I thought that the Pfizer, correct me if I'm wrong, thought the Pfizer vaccine was now approved for 13 and under.
So the Pfizer folks have submitted application now based on the data they have to have the FDA approve the vaccine for 11 and under. Right now it's available for 12 and up. So 12 and up can get it, but 11 and under cannot. And they're just waiting for approval from the FDA. So they said it should only take a few weeks for them to review the data. And then they should be doing the 5 to 11. We actually will be doing the 5 to 11 year olds and start getting them vaccinated as well.
Okay.
I mean, I heard on the radio this morning, and I think Connecticut's up to over 75% of the people are vaccinated, or at least had the first shot.
Probably the first shot, I would imagine, yeah.
So don't you think that we're going to be in a better position come fall than we were last year because of the vaccinations?
No, I think we're already in a better place this year.
I
mean, we're seeing the numbers are getting better each week. The number of hospitalizations have been going down. I mean, part of my concern is now flu season is starting, and there's other things that are going to put people potentially in the hospital. So, we're already getting interest in having people be vaccinated for seasonal flu as well.
Yeah.
I think things are definitely getting better. And that's why I say things are getting better. Let's keep it up. Let's keep the effort that we're putting forth. And now with the kids that are under 11 going to be able to get vaccinated, that's a whole other group of people. We're talking about the booster doses. So that's the other thing. We're just waiting on the state to send us the standing order that we have to use. So what happens is we get the approval that we can do the booster dose.
Yeah.
We have to get a standing order from the state, and then we have to get our medical advisor to sign it.
Yeah.
So we got it yesterday. It goes to the medical advisor today, and we're hoping by next week we may be able to start doing some booster doses as well. So a lot of progress, a lot of positive things.
But I will tell you, there is some negativity on the booster.
Mhm.
A lot of people are skeptical of getting the booster because they don't know what the reactions are going to be.
Mhm.
I know I talked to a few people that are over 80 and it's like,
Well,
I'm
keep
gonna
in
wait.
mind, it's the same thing that you got
Yeah.
the first two times. So we remind people, and again, talk to your doctor, get the information you need. I think it's important for us to say, we understand if you have reservations, it's okay if you have reservations and you're concerned, just get the information and we'll be there for you if you want it.
Yeah.
That's really our role, is to be there if people want it. We make it available to them and they make the decision themselves. The idea that we're forcing it down everybody's throat isn't the reality. The reality is it's there for them if they need it.
If we could just go back to the masking, you mentioned we both had masks. Anywhere indoors,
I wasn't ridiculing
No,
or
no.
anything like that. I was just kind of curious as to why.
Anywhere I go indoors, I wear a mask. And I look back, at the flu season last year, it seems like we were masked and there was really no flu season. So I think it is beneficial. I look at it too when I go to a commercial establishment, Walmart, Home Depot, wherever, the employees have to wear them. So I look at it as a courtesy thing. If they're wearing it, I wear it.
Mhm.
That's the way I look at it. And most recently, I think I know probably a half a dozen people that have tested positive. Some of them have gotten very sick, all vaccinated. So it's concerning because it's now, in my eye, more people I know that are closer in the community to me, that I'm seeing, where before I didn't really see that. So that's why I do it. I mean, sometimes I go places and people look at me funny because I'm doing it and they know me, but my choice, that's the way I'm doing it.
Paul, we've talked about it a million times.
Yeah.
So your body, your choice.
That's
You
right.
do what you want to do. I mean,
Well, I read an announcement from one of the state reps up north of us the other day, and they were talking about whether or not they were going to support wearing the masks in the legislature this year. And this particular representative put out a statement saying, our numbers are down. I believe in liberty, et cetera, and I feel like I shouldn't have to wear a mask. And all I kept thinking was, but you're in a leadership role. All we're asking is to set the example, let people know that it's not a bad thing to do it. Rather than make a statement about how you're not going to do it,
Right.
maybe say, but I'm encouraging people to do it because it's okay.
Absolutely.
I know kids have to do it in school, things like that. So if the kids have to do it all day, is it really going to hurt for a legislator to put it on during the legislative session? So I see things like that where, be the adult in the room and set the example. I don't think there's anything wrong with that.
No, you're right. And there's a lot of legislators who are not wearing them.
Right. And I don't have issue with that, but to make a statement saying I'm absolutely not wearing it because I want to keep my freedom and my liberty, I don't think it's a freedom and liberty thing to wear a mask. It's just not that big a deal, to be honest with you.
Yeah.
There's many more things that we do that
Yes.
are restrictive, I think, in life.
Is there more pullback from people in our generation on wearing the masks more so than the younger generations, like the Gen Zs? Like, for example, my daughter, both my daughters, it's like, no problem, put the mask on. Yep, that's good.
Yeah,
They're completely accepting of it. I don't have a problem with it either. In here, it's just us.
Yeah.
So it's kind of like, what's it, and haven't I've asked you before, do you want us to wear a mask?
Yeah.
And
And
I didn't ask it this time.
Remote call-in you've offered in the past when we had high numbers. And,
Yeah.
we've always been try to accommodate each other that way, and
Sure.
it seems to work. I mean, I'll say at the town hall we have the mask, or town buildings actually, we have the masking requirements, and we've had very little problem.
Yeah.
Right.
And we had one or two that came in during tax time, and we asked them to wear a mask. We offered them one, and it wasn't a problem. So, overall, I think, it's been accepted in the town buildings.
Yeah.
I think if you approach it in a respectful way and you just explain to people that, we have this policy, we're just asking you to follow it. We really appreciate that you're here today. And if you talk to them in the right way, if you point fingers and say, you should, you must, you have to, I think that's
That's
the
a good
reason.
point right there.
Yeah. And I think that's what we've been doing with kids is say, look, kids, this is the policy for this year. This is what we're following. My daughter follows rules from the second she gets to school to the second she gets home. She knows where she has to be. She knows what she has to do. She knows what she has to wear.
Yeah.
And the mask is just sort of part of the uniform for them.
Yeah.
It's, it's the adults that lead the way. And I think the times you hear that kids are struggling with it, it's because the parents are struggling with it. So again, I think, it's just giving the right message to the kids saying, if it's a rule, please follow it. It's like anything else you'd ask your kid, if you see a stop sign, stop at the stop sign. It's all that same stuff.
Yeah. And I mean, some of the kids, even, our grandkids, they were happy to wear a mask just to get back to school to see their friends.
Oh,
Yeah.
sure.
And, from the ones I've had contact with, it seems like that's the statement. They just wanted to get back into a regular rhythm and, see the people that they missed for that year. And we're more than happy to do it.
So how's the town of Griswold doing in perspective to New London County? I mean, how are we looking?
Last I looked, our town vaccination rate was about 53 to 54%.
Fully vaccinated.
Fully vaccinated.
Oh.
Which it's going up a little bit. We were under 50 there for a little while. It's slowly rising, but it's rising. So, that's a positive thing.
Yeah, because I think, don't forget, a lot of companies now are mandating it as a result of the 100 employees. So.
Yeah, well, you may have seen in the news yesterday, we've been asked by some of the McDonald's now to go in, and we actually did one in Norwich, and now we're being asked to possibly do the one in Lisbon. And, obviously part of it is they want to encourage their employees to get vaccinated. So having us there to do it makes it readily available.
Also have
really...
a vaccination clinic right there.
Yep. So we've done those, and we did the one yesterday. They said, I think it was 9 people got vaccinated. 8 of them were employees. So I think what they're saying is I'm willing to do it. I just got to make time in my schedule. And if you're there, it's really not an issue, and they'll do it. But they offered, they'll advertise in the drive-through for us and say they're going to be here on this date if you happen to come by. We've had businesses offer free ice cream and free drinks and cookies and things just to encourage people. So when you have that support from the business community, I think it flips what people assume, which is the business community is feeling restricted. They're feeling like they're getting all these, things put on them. It's becoming difficult. I think when we show them, hey, we're willing to partner with you, do this, I think it shows a nice partnership. And we want that partnership when we have to work in the community and make these available to them.
Sure.
We're always going to places where we think we're going to have activity. The days of setting up a clinic somewhere up on the hill and hoping people come to you is not happening anymore.
Oh.
So we have to be where the people are and where they're frequenting anyway. And then if it's there and it's available, most people will say, I hadn't thought about it, but since you're here anyway, and they take advantage of it.
Yeah, you're going to have to do the same with the booster shots.
Right.
Because it's going to be, because most of the people going after the booster shots are 65 and over.
Yeah, well, we've even talked about
it's going to be difficult to get them to go specifically down to Bacchus Hospital to get a shot.
Well, there's a lot of differences, when you talk about changes. So places that we were holding these back in last year in the fall, senior centers are open again. Schools are open again. Schools aren't available during the day. Senior centers aren't available during the day. Seniors like to go out when it's light out. They don't want to go out when it's dark. So we're trying to look at what the schedule is, what the time is, when we can get into places. So one of the things we talked about was maybe doing like a 4 o'clock at the senior center up in Norwich. It's a place people remember us from in the fall, and yet it's going to be an opportunity for them to get it before it gets dark.
Sure.
The drive-through testing sites again, they were saying that people weren't going because it just wasn't available. A lot of teachers and people that have to do it now if they're not vaccinated, they were saying, I don't want to miss work to do it.
There's one in Wallingford that was sent home.
Yeah. So what we're doing,
unpaid leave.
Yeah. So what we're doing is 3 to 7, Monday, Tuesday, Thursday, Friday at Todd Stadium.
Oh yeah.
And then Saturday mornings from 7 a.m. to 11 a.m. at UCFS in Griswold. And again, just trying to work around people's schedules and make it available to them. I've actually heard it's been really busy up at least at the Todd Stadium one.
Yeah, this one has been busy on certain Saturdays. I've seen quite a few there. But it's nice to have something in town available.
Oh yeah.
We do have a lot of people that depend on the public
Plus
transportation and
Plus
things
some
like
people
that.
can't drive either.
Right.
So it makes it easy for them just to get over there.
Yeah.
Has the town thought about using, like some form of public transportation?
Well, for the boosters, I know Hartford Healthcare reached out to the senior center, and I think they were going to try to schedule something, but I think it was in Franklin. I don't know if you've heard about that, Patrick, but they did ask if the senior center would provide transportation, and it said they would work with them and the seniors to accommodate whatever they could. If that was what's available and that's where people want to go, they'll make it happen. So
the good part is they have the mobile vaccination van or the mobile van that they have.
Well, that was part of it, because the next question is will they be going door to door?
So with the homebound piece has never stopped for us. We've already got.
By appointment, door by door. You know what I mean?
Yeah. So there's still a website through the state health department specifically for people that are homebound who need vaccine. So people can fill that out. It's at the state health department, the CTDPH website. And then each week I get an email about every one of my 11 towns, and it gives me a list of any homebound people that are interested in getting vaccinated. It doesn't have to be the individual who's getting vaccinated that even fills it out. It can be a caretaker, a family member, somebody else who knows they need the vaccine. And now we're starting to get calls from people that said, hey, you did their vaccine for COVID. Would you be able to do their seasonal flu vaccine? So we're getting more interest in that way. So it's good. I mean, people know we exist. They know what we do, and they're willing to reach out to us. So we'll try to accommodate what people need. And we've even said, if you don't feel comfortable coming to a clinic, either you don't want to be seen at the clinic, or you don't have transportation, and you're not in that older age group, we will still come out and vaccinate you if you need to. So there's people who have anxiety issues, tend not to leave their house very often for different reasons. We've done those folks as well.
have you experienced any shortage of the flu vaccine? I know there was a couple things in the paper about it. Just curious if.
Yeah, so we order early.
Yep.
So that's been helpful. So we got our first delivery 2 Thursdays ago, and we started scheduling clinics. And we generally do a lot of larger businesses first before we open it up to the public, and then we'll do appointment clinic schedules through our office. And then we get the Vaccine for Children program. So we've already placed our order for that. And we're usually sort of the fallback for Vaccine for Children. So if you don't have a pediatrician who has the vaccine, they'll call us because there's still a requirement by January 1st. Many kids still have to get vaccinated with the flu shot, the younger kids. So we get those calls on like December 20th saying, I got to go back January 1st. And what am I going to do? Or kids that are going back to college will call us saying, oh my God, what am I going to do? So those are the ones we typically hold it for. And then we can do them, towards the end of the calendar year.
Excuse me. Do we know there's a difference in dosages for the smaller, younger kids? Is there a difference in doses for this booster shot? Are they the same as the original shot that you got? I mean, is there a different level?
Yeah, so I think they're going to end up with a pediatric dose for the younger kids, but the dose they will get from each dose will be the same.
Oh.
So or each shot,
So the booster shot will be the same level as you got with the second
absolutely.
shot.
Yep.
Yeah. Okay.
The question I have is really around kids in school. I remember when I was in school, I would have to get, or a whole class would get moved into the nurse's office usually I think it was 4th grade,
Yeah.
and there was Dr. Goslin. And you're getting a shot. And it was either the flu. It was either the flu or mumps, smallpox, rubella, whatever, you know, the whole thing. But you had to have the flu vaccine to continue to go to school.
Mm-hmm.
And you remember?
Yeah, I do.
Okay.
Yep.
And there are, in the past, there have been healthcare workers that have been mandated to get the flu shot. Why is this any different?
I don't really think it is. I mean, I think there's certain.
Well, what I'm saying is that there's pullback, you know, and they're really struggling with trying to get to like a herd mentality of 70, 75%, whatever the number is now.
Right.
They're struggling with that. Yet back 40 years ago, I was sent to school and say, hey, you're getting a shot today. I am.
Yeah.
If I knew ahead of time, I'd have stayed home because I was scared to death of that stuff.
Right.
But now, cool. But I mean,
well, and back then the parents used to say, just go and get it. It's not, you know, I'm not there. So a quick funny story. So my father used to tell the story about his brother, and his brother was playing basketball. And apparently when they were playing basketball at the court where the Catholic school was that they went, he said, look, you know, they're swearing, they're kind of yelling, and the priest from the church comes in and sees it, takes my uncle's basketball and walks back into his place he's living, and says, you're not getting your basketball back and you're off the team. So my uncle goes back home and tells my grandfather, and my grandfather says, get in the car, we're going back over to the church. So they go back over, and he said, my uncle said, I knew I was going to be getting that basketball back, and he was going to tell the father, and actually the priest's name was Father Vicious back in Blessed Sacrament in Waterbury. So he goes, I know he's going to give it to Father Vicious, and he's going to tell him he's getting my basketball back. So he says he walks up and knocks on the door, and Father Vicious answers the door, and he says, Father Vicious, you have my basketball. He says, look, your kid was swearing, your kid was doing this. He goes, I don't care what you do to him. That's my basketball, and you're giving that back to me. So he gets back in the car, he takes the basketball. So my uncle said, you know, but that's the mentality that used to be, you know, back in the day was,
right.
You know what, you do what they tell them to do, but, you know, if it affects me, it's something different.
Yeah.
And I think that's to some extent, you know, it was, you know, you see it differently for the kids than you necessarily see for the adults. Some people feel like I'm old enough now, I can make my own decisions. I don't want to be told what to do. Other people have a real fear of getting vaccinated for whatever reason. You know, it's either that it came so quickly, I'm nervous about, you know, like you said, if there's going to be something different about this vaccine than there is about those other ones that have been around for years.
Right.
Keep in mind the seasonal flu vaccine, they really look at the development of it every single year. They sort of change the way it's developed. So we're always redoing vaccines. They're always getting approval. The process may have gone faster, but the data that they had to put together was very similar. So I tell people, you know, don't feel so nervous about getting it from a medical point of view. But if you do have a question, and every person is different, ask your provider before you get it.
Sure.
But, you know, I think, like you said, the fear is different these days, and people read a lot. I mean, social media, we've talked about that in the past.
That's the big difference.
It is.
Yeah.
Is social media.
There's so much information out there that people look at.
But there's so much misinformation as well, no matter what the subject matter
I
is.
think, you know, in total, there's just so much information people can look at. And if you read it all, I think it can be very confusing because it contradicts itself a lot of times.
Probably back in the day when you talk about getting your shot, your parents probably got one sheet of paper that said, this is important for your kid to get it. They're obligated to get it to go to school, sign here. And that was the extent of it. There was nowhere to look up information.
Right.
The person they went to for their own care was Dr. Goslin, and they knew that he was going to take care of their kids, so they didn't have any question about that. Now you're going
And
to
his wife.
now you're going to some nurse that you've never seen before. It's some clinic you've never been to before. It's not in a medical facility. People question things like that.
Yeah.
So I don't begrudge people for being nervous. And I also recognize that there is so much information out there, and people are trying to do their best to collect it, but it's confusing. And the more stuff that you spend time looking at, the more confusing it gets.
Mm-hmm.
So as I said in the past, you know, look at those reliable sources, the CDC, the state health department. If you consider us reliable, go to our health district website, but use those sources and talk to people that have gotten it and say, what was your experience? And was it a good one or a bad one? I think it's important because the majority of people, I think, are going to say it wasn't a big deal. And I'm glad I got it, and I feel safer because of it.
I mean, that's what I did before I got mine. I talked to people that had gotten it before me and asked, you know, how was the first shot? How was the second shot? You know, what did you experience? And kind of educated myself and prepared myself for what I think could happen.
Yeah.
In customer service, they say if you have a bad experience, you're going to tell 10 people. But if you have a good experience, you're probably only going to tell 3 or 4. So we hear a lot of stories that somebody got a vaccine. They had an adverse reaction, either death or something else. Is this what we're experiencing? Like one person.
So I'll tell you an interesting story. I'm filled with stories today. So I used to, one of my first jobs was at the Cancer Society, and we used to have a program where people that have had cancer, and a lot of them had breast cancer, would be available to people that were just diagnosed. What we were finding was you'd get women that were diagnosed that were in their late 30s, early 40s, and they're talking to a woman who's now in their 60s or 70s who had been diagnosed as well and had treatment. And they'd come back and they'd be in tears and, oh my God, I can't believe this. This is terrible. It's horrible. I can't get through this treatment. We said, well, what did they tell you? And what they were doing was describing their experience that they had 30 years before. And it wasn't consistent with what the treatment is today.
Now,
So
yeah.
they were scaring the heck out of these people.
Sure.
And I think that's what people need to understand is not everybody's circumstance is exactly like yours.
Right.
So you can talk about, was the line long? How did they do as far as giving you the shot? What were your symptoms? But also tell me a little bit about yourself. Because if you talk to somebody who has underlying medical conditions, maybe they're, obese, maybe they, all those different things that go along with it, they may have a very different experience than you because of those things. We had the majority of people that were having trouble, at the clinics that we were finding, it was because they were nervous. They went in with some anxiety. That we had a harder time with the 1-dose people than we had with the 2.
Really?
And they said it was because they went in, they only wanted 1 because they were afraid of needles and they only wanted to get 1 shot and be out of there. So they'd go in, and we had a couple of people before they ever got in, they were already in a wheelchair because they had passed out as they're walking in. They were nervous. We had one guy who looked at his arm and saw a little dot of blood, and he passed out in the chair. So it was a lot of that stuff was just people got themselves so anxious and worked up. But when we had the older folks, they were blowing right through when they were getting theirs because they're like, I get shots all the time. I get needles all the time. I've had so many things over the years. I don't really care what they put in me. I just want to be safe and get back to my grandkids. And
Yeah.
I told them, don't even put a Band-Aid on me. I'm not even going to bleed. And I didn't either time.
Well, that's the vampire thing, right?
That's true. I got nothing in me.
Free advertising for your vampire stuff.
I'm dead to you. Yeah, that's true. That's coming up pretty soon.
Yeah. I thought you were putting in a plug.
Yeah.
We could. Oh, we got shirts, by the way. Vampire shirts.
Do you guys have any kind of message you'd like to give the people in town as far as COVID goes?
Before we go there, Paul,
okay.
Before we go there,
Go ahead.
we have a question from a resident, and it's Rich Waslick. Pretty much everybody knows him, and I'm just going to read it just as he has typed it, and either one of you gentlemen can take the lead on it. So Rich asks, if the flu vaccine is not always effective, why is this different? Need to explain how the vaccine works because it is understood that vaccines don't stop people from getting true illness. Is that really correct?
Right. So we've talked about the fact that, in certain years, the effectiveness of the flu vaccine may be very different than another year. You've had years where it's 50%, you've had years where it's 70%. And they try to sort of guess as to what the type of flu is that we're going to have at the end of the year, when they're in the beginning of the year developing the vaccine. What we continue to remind people is, while it may not keep you from getting sick, in all likelihood, it's going to keep you from getting as sick as you would if you weren't vaccinated. And it's very similar with the COVID vaccine. It may not keep you from getting the illness, but it'll likely keep you from being hospitalized or dying from it. And that's part of it, is minimizing the symptoms, keeping people out of the healthcare system. Whenever we've talked to the hospitals, they've always said, make sure you get people to get these vaccines because we just don't want to be overwhelmed. And we talk a lot about, that's the public's role in all of this, is to keep our hospital system from being overwhelmed so the people that have critical care needs can get it. Keeping the disruption, and we've talked about that in the past, the disruption on our lives down by virtue of having outbreaks. So that's why we ask people to quarantine and isolate, so they limit the number of other people that get exposed. All of those things are parts of it. And I think, to Rich's point, it may not be 100% effective, and we don't claim it is, But it does help and assist us with the hospitalization piece. And then when you talk about how things are going in town, I tell people, these are the things that you're doing to help our community. When you look at the numbers in the hospitals and you see that we don't have the hospital overwhelmed and the ICU units aren't overwhelmed, and when somebody has to go to the ICU unit, they're not transferred from hospital to hospital. That's the public doing the right thing, keeping people out of the hospital so that way those people get the care they need. So I think there's a huge responsibility on the part of the public, and they've really stepped up. And, to have more than 1 out of every 2 people walking down the street be fully vaccinated, I think that's pretty impressive.
Yeah.
So the government, medical personnel, and I'm sure health districts are familiar with coronavirus.
Mm-hmm.
This is not the first coronavirus. H1N1 was one, correct?
Yeah, well,
There's been a bunch of them.
Well, we've had, when we talk about pandemic planning, everybody thinks we started doing it last year.
Right.
And the reality is I've been through West Nile virus. I've been through SARS. I've been through, you name it, I've been through it, Ebola.
Mm-hmm.
So, we've been planning for this type of scenario for a long time. But the reality is we've planned for short operational periods. Our operational period right now is going on, like 24 months. So it's not what you typically would see in an emergency situation.
But the question I wanted to ask is, when it comes to the vaccine, wasn't there already a prototype in place because of past coronaviruses?
Well, what they've had is they've always had planning around how they would develop a vaccine if they have to. So that's always been in place. And then they have to identify what the virus is so they can make it match. And that's me not being a medical person and trying to just speak to it as a regular Joe. But they've been planning for how they were going to do it. They have relationships with vaccine developers to be able to do it. And I think what we're finding is the system isn't perfect. And there's a lot of ethics involved, and there's a lot of storage issues involved, and a lot of movement of vaccine around the country that we're learning from it. So I do think if worst case scenario this ever happens again, I think we've learned a lot from what's happened here to make it better next time.
All right. So again, staying with the vaccine and the effectiveness or the safety of it, there's 4 that I know of. There's Pfizer, there's Moderna, there's Johnson & Johnson, and there's AstraZeneca. Is there another one?
So right now in the U.S., we're using Pfizer, Moderna, and Johnson & Johnson.
Right.
Yep.
So why are they so different from one another? It seems like I hear, well, they pulled Johnson & Johnson for a while.
Mm-hmm.
I've never heard anything about them pulling Pfizer or Moderna.
Mm-hmm.
So, and that one's only a one-shot deal. Why are they so different?
Well, so different companies are making them. Studies are being done differently. The formulations may be different. There's a lot of things that go along with it. And what I hope people understand is, and specifically with Johnson & Johnson, the reason that they pulled it when they did was because they were concerned about a clotting issue. So they had to put the brakes on it. We were actually doing a clinic with Johnson & Johnson the day they pulled it.
That was AstraZeneneca too in Europe.
Well, with Johnson & Johnson, I was like, oh my God, we have people lined up outside and we're going to be given this vaccine. What do we do? And I remember calling the state health department. They said, we're getting a lot of these calls. Just hold on. And we were, so we ended up pulling the plug before the state pulled the plug.
Mm-hmm.
But what I think it tells people is they were constantly studying, and each vaccine they were studying and looking at its impact on people. And when they would hear about problems with the vaccine, or somebody would say they had a severe reaction, they immediately jumped on it. So it didn't take a lot of numbers for them to have to feel like they had to stop the process and then make sure that there was a safety measure in place. So, I think they look at them all differently, but that's a good thing, because it means that, they're not broad-based saying it's an approval. They're constantly studying it, and we send information if we ever hear of a problem with the vaccine.
And I think that's something they got to continue to do, especially when you have these different variants.
Mm-hmm.
They have to continue to look at what's out there, what the vaccine is, and how effective it's going to be. So it's an ongoing thing. I agree with you to keep track of it all.
The last thing I would just say is, I hear a lot of people, and I guess we represent government, we represent politicians, whatever you represent. But I can say my experience with the folks like your first selectman and a lot of folks at the table, we all live in the communities. We're all concerned about the same things. I remember, I was worried about my mother because of her age. I was worried about my kids because they were in school. They couldn't be vaccinated initially. All those things that people are worried about in the community, we are worried about as well. It impacts you. I know when we looked at the numbers, it wasn't just about the numbers in the community. And I can say that I'm on by two times a week, we've been meeting for most of the time this has been going on in Griswold. And your fire department chiefs, your first selectman, your senior center director, your health director, all these folks are coming to the table, your fire marshal, your, all the emergency management director. They're at the table and they're looking at it from an individual perspective. My goodness, we had a death. My goodness, we have more numbers. This is going to impact our community. How's it going to impact us? They all know their neighbors. So I think when you realize that we're looking at it from that level, it's not just about getting vaccine into people and we're trying to follow some guidance from the state. We look at it from a community level, and I think that's what I want people to get from this is that, I represent the health district. We represent 11 towns, but each one of my towns looks at it individually, and I think they really care about the community they serve.
Yeah, and when we started having those meetings early on, there was a lot of goals there. One was, what the fire department was experiencing, making sure that they were warned of positive residences before they responded. There was a lot of that early on, making sure they had the proper PPE and quantities of it. There was a question there for a while, then that got better. So we still now meet weekly. Now that, we see numbers going up again. For a while, we stopped meeting when it was pretty low and quiet, but we're still addressing those same things. Are there any needs? What do we see as trends? Are you seeing a lot of, positive contacts when you go to calls, things like that, so we can get a handle on ahead of time if we're going to be looking at needs or any other things that we want to address.
And town halls are, there tend to be maybe a more mature population in the town. So they have to worry about the impact on services to the town. They have to worry if volunteers are going to come to work because they're concerned and they're worried about the safety of their family. You hear about transportation issues for schools now and whether bus drivers are going to be there. And so all of that impacts the community as a whole. And that's the part I think people have to
It's not
understand.
just age groups. I've seen lots of reports that were based on ethnicity.
In what way? Say again.
Ethnicity, race.
Yeah. But for which? For the
testing.
Yeah. Oh, absolutely.
They were breaking it down via, there was one that if you were African American, I think it was like 54 to 59.
Yeah. Well, we always talk
more
about
susceptible.
We always talk about the social determinants of health and how things like race and ethnicity can impact your ability to access healthcare. We've been looking at that for years. We recognize that that's a barrier, and that's why we actually have a vaccine equity program grant that we implement where we take vaccine into those communities, and then we use actually UCFS and TVCCA has community health outreach workers, and they support our program by sending us out with people that speak the language of the people we're trying to reach out to. They know the community, they can converse with them, and they can educate them before we go back in with the vaccine. So one of the things we learned right off the bat was don't go in with the vaccine right away. Go in with the outreach workers, give them some information, help them to understand the purpose of why we're going to be there, and then come back the next week. And that's when they tend to come to you. So it's really been a learning experience for us.
Did you have something you wanted to talk more on a local level now?
Yeah, I would just say you had a message to give anybody in town because we are local here. Any messages you want to tell the folks in town about?
Well, I think the biggest message to get out is if anybody has any questions, where they can get tested, where they can get vaccinated, what we have locally in town. We have stuff posted on our website, but we're more than willing to give that information out if they want to call a town hall. We're trying to put it out on as much social media as we can through the town and make it accessible to everyone.
We try to keep our website up to date as best we can, and every now and then I get somebody who says this is 3 months old and I can't believe it's still on there. But we're in the health department business, not the website business, so we do the best we can. But that's the good place to start for us is the website, because you may just get the information right there. If not, they can call our office, which is 860-823-1189 for the health district. And then my email directly is DOH, like Director of Health. And yes, we've made the Simpsons comment about Doe. But DOH at Uncas, which is UNCAS HD, like healthdistrict.org. And you can find it on the website as well. So we want people to reach out if they have questions, and if there's something we can answer, we'll certainly do that for them.
And I have to say, from Just personal experience about getting testing. This was before it started up again at Dodd and started at UCFS again, or QVC, Quinnebog Valley Community College is doing it, and Plainfield Town Hall
Plainfield
as well.
Town Hall, yep.
I called because I wanted to find out where I could get a test.
Yeah.
And I talked to a gentleman, and he was very, very thorough.
Oh.
So I can't remember his name.
It was a little challenging there for a while. We had a couple of staff that
It was in Norwich. He told me to go to.
Okay.
Yeah, we had some staff that wanted to get tested and wanted to go like we have now to a drive-through and just get it done. And found most places had to make an appointment. It was going to be a couple of days, so it was a little challenging or delayed there for a little while. But it's gotten much better now that we've opened up the Dodd Stadium and UCFS.
Yeah. I'd be remiss if I didn't say the school department has been at the table for all of our meetings as well.
Yes.
And Sean McKenna is always on our calls, and they have their own challenges, but the goal is to have kids be able to do things they couldn't do last year. So I always say, think back to your calendar from last year, and kids weren't in school fully. Kids weren't doing extracurricular events. They didn't have football and soccer and all the other things they were doing. The teachers who need to be tested need that resource, and that's part of doing that. And the schools are balancing the quarantine and isolation stuff. And I occasionally get calls from parents, and I say, please just be patient, because we're all working through this together. And the goal is to keep everyone safe. So if they're maybe seem to be more conservative than you would like, keep in mind that they're doing that in the best interest of your child and all the other children, or in the best interest of the town hall and all the other people who visit, those types of things. So again, it's just, please be patient with us. We know it's challenging, but if you continue to give us a little bit of space as we make these decisions and try to think through it, we'll all be able to get through this together.
And I'll tell you, school is such a important piece to the kid's mental health. You're
100%.
talking about kids, wanting to get back and, see their friends and stuff.
Mm-hmm.
We have two that, for example, Melissa's youngest, talk about experience. It's his senior year in high school.
Right.
You don't want to miss that experience. That's a great year.
Right.
And my daughter, she's a freshman.
Yeah.
Again, an experience. Sophomore, juniors, whatever.
Yeah.
But freshmen and seniors, and those are two things that I'm so glad that they're able to experience instead of being shut down. Because last year, both these two kids had a hard time.
Right.
Hard time the entire year, as well as others.
Well, if you look at last year, I remember going to a drive-through graduation.
Yeah.
That's an experience that, you can't really miss.
Yeah.
That's the last time you see your friends and get your yearbook signed and a lot of things usually. And, it was a drive-through event, which, those students won't forget that, I'm sure.
Yeah, my wife had to remind me that you can't ignore the fact that your daughter or your son wants to go to prom just because you didn't go because you couldn't get a date. It's still important to them, even though you may not have been able to go. So it's things like that. I think everybody.
Dude, I went to 6 proms. 6.
Well, your sister goes to a lot of proms, I'm sure.
Oh my God. No, I just had a lot of girlfriends.
Good for you.
They all hate me now.
They probably follow you on this.
Yeah, for rightful reasons,
But I agree with you. I think, and the resources that are at a school, as an example, people don't think of that, but they have social workers, they have coaches, they have peers, they have mentors, all of those things that are in place when we talk about mental health. I mean, those are the things people need. And not everybody has 2 parents at home. Not everybody has parents that can be at home because they're at work. And they use those adults as role models throughout the course of their day. So, there's a lot of things. And food. The one thing, we couldn't believe the need for food in our community until we recognized that people didn't have access to it. And thank goodness for the schools, because they were a great resource, and United Way with their food distribution and a lot of different things that were unheard of before as far as getting food to people.
The mobile food pantry, St. Mary's food pantry. I mean, and that was one of the other things we did. We closely monitored, the food supply at St. Mary's, and there was some state things available, but you had to run out. So we were constantly saying, are we going to run out? Because we got to be ready if we do, but there was a big demand, big request for that type of stuff.
Couple of questions up on the board here that I want to go ahead and address. This is Rich again. And I don't know for sure, but I'm going to just kind of venture a guess. This has something to do with maybe Governor Lamont extending his executive orders. He asks, is there a real chance this will be back to normal? Doesn't seem that way. That's the thought out there. Who wants to grab that one?
I'm hopeful that we're going to get back to normal. I think it's going to depend how we approach the winter months here coming up, and I think a lot of it's going to be, how things going forward.
Yeah. I mean, there's been a lot of discussion about rolling things back, and I think that's the part to remember is we didn't roll things back. We may be continuing to wear things like masks. Some of the reasons the governor puts those orders in place too are to be able to get things like access to grant funding, because if you're in a process where you're in an emergency situation, there's an executive order in place. He may have access to things you wouldn't otherwise have access to in an emergency. So sometimes there's more to doing those things than just trying to put things in place for the public. It may actually be accessing resources that you could then distribute to agencies and places like mine. So I think, there's value to it in some ways. And I think the fact that the governor is continuing to put an emphasis on this is in part because he's seen that ebb and flow, and things get better and then they get worse. So that's what we don't want to happen. And that's how I think things continue in the direction of being back to normal.
Okay. Lori Sorter has a question. Hi, Lori. Good morning. I am just out of quarantine for a positive COVID case. Can I get the booster? Can I get the booster shot now, or is there a wait time?
Yep. So if she had a positive case, the one thing is, as far as the quarantine period now, she will not have to, if she's exposed to a positive case, she'll now be available for 90 days to not have to go into quarantine. And yes, she would be able to be eligible for the booster. So we'll be happy to talk to her about that and how to get it to her.
Okay. All right. Now, I know you have to leave at 9:45.
Yep.
So
It's coming quick.
yeah, it's 9:40. I've been watching the time.
Okay.
So I just want to ask you a couple of town questions real quick.
Okay.
Just updates. Data center. Are there any updates regarding the data centers?
The last we talked to them was probably 2.5 weeks ago. They were supposed to come in and make an announcement either late this month, early October. And when we talked to them, they're looking at closing on properties on November 30th. So as far as we know, that's still the plan. I would think within the next couple of weeks, we should have some kind of an announcement from them.
Now, I heard a rumor, and it's a rumor, but I do want to bring it up because you know how rumors are. They start, it's wildfire and goes everywhere. I don't even know if you know the answer to this question because it would be just really a private business deal. But I heard there was one that was possibly pulling out.
One what?
Polinsky.
As far as the property?
Yes.
So the property is being renegotiated right now.
Okay.
There were some concerns with part of the property, with some easements, things like that need to be worked on. So I believe they're going to renegotiate that, and that'll be successful.
Okay. Because you got to get an answer on that one way or another, because somebody puts it out there.
Yep.
It just kind of spreads like crazy.
Yep.
So how are we sitting? As far as a town,
As far as
COVID-19.
I think as of last week, for a 2-week period, we had about 65 to 68 cases over that 2-week period, which is consistently since Labor Day, been going up each week. If we look at the numbers back that far. So, I mean, it seems like the last 2 weeks, we may have started to level out. I think we were at 72. We went down to 68, if I remember correctly. So, maybe we're starting to flatten that curve, hopefully.
And I just remind people that the report we give each week and we post on our website and the first selectman gives out to the town folks, it's generally about 2 weeks behind in terms of the data.
It's always been like that.
Yeah, but we also get weekly data on the district in terms of numbers. And last week was the first week we saw a reduction in the number of total cases in, probably 2 months. And that's amazing because we know more people are being tested now. So when the test rate goes up and the numbers drop, that's a really good sign that things are going in the right direction.
Yeah, good.
Well, we should say goodbye to you because it's 9:43 and I don't want you to be late for your meeting.
Yep. No, thank you. And
So-
I'm sure Patrick will stay for a little bit longer. I don't know how long, but
A couple more minutes.
Okay.
A couple more minutes.
All right,
So thank you very much, Todd Babbitt.
Thanks, Todd.
We'll have you. We'd like to have you in, just yourself, and we'll talk about the town and what's going on and stuff like that.
I'll reach out to you this afternoon.
Sounds good.
Thank you.
All right, Todd. Thank you very much. First selectman here in the town of Griswold. Always very able to come in and talk about whatever is going on in the town. Anything that we haven't talked about that you want to mention, or here's a question. You talk about 2 weeks now. The data that comes off of the state website every single day, and I get it in email, and people get it via maybe the Channel 3 app or whatever. Is that also with the daily positivity rate? Is that also 2 weeks behind?
No, that's more up to date. Yeah, and what they do is they'll tell us the data they give us. They basically have cleaned the data, so they make sure that they.
That's a dangerous statement right there. They've
right.
cleaned the
Not
data.
clean the data. All right. Well, maybe clean isn't the right word.
Because you know why? Because people are like, they're skewing everything.
No, well, what they're doing is they're making sure that the data is correct in that they're following up on the cases due to the contact tracing we do. So it's a lot of that type of work where they're making sure we validate the case, that they're putting it into a format that we can understand. So they do it by town as opposed to by county or by state. So I guess clean, you're correct. Clean probably wasn't the right word. It's
I just didn't want you to get any feedback.
Yeah. I'm used to getting kicked in the pants about things I say. So I think if I use the word clean, then at least it's clean.
It's clean.
You may want to beep that out.
I can. It's there.
No, it's there. I don't worry about it. I think if you understand the context of what I was saying it in,
Sure.
which is making sure that the data is correct and it's by town.
That's why I wanted to make sure we clarified that what you meant by that.
Right.
So people don't kick you in the pants.
Yeah. So when I say I'm going to go home, I'm going to clean the windows. I'm going to say, you know what? Actually, what I'm going to do is I'm going to spray them and I'm going to wipe them down appropriately.
And then I'm going to check the data on them to make sure that they're cleaner than they were when I got here.
Yeah.
Well, it's funny because nobody's ever cared about our website, the data we put on our website. I think we had, less than 100 followers when this all began on our Facebook.
Ours too.
Yeah. Yeah. But I mean, and now people are, where's the data? Why isn't it out yet? It's Thursday. What are you doing with it? And we realized real quickly that people were making decisions based on the data we were putting on our website. And that to me was amazing because the state has never had real-time data provided to anyone from a health department standpoint. And that's always been the concern is they want to make sure it's accurate, it's checked, public health is always about checking and rechecking your data to make sure it's accurate before you put it out. But because decisions were being made, it was going out quickly. So that's where you'd get a lot of questions. So the one thing we asked for in probably November of last year was we asked the state to provide the data to us rather than us take their data and then try to turn it into something else. Because every health department in the state was making it look a little different. And some were doing pie charts and some were doing graphs. And I said, if it's consistent, it looks the same, then that way the public can look at ours compared to others. So Uncas Health District at the time had asked for the same thing. They said, we like what you got. Can the state do ours as well? So they've done the same thing. So now if you look at our data and the Uncas data, it looks exactly the same. So you can compare, is New London different than Griswold? Is Griswold different than Norwich? And it's kind of a neat thing because when we meet at least once a month with the Council of Governments.
ECOG?
Actually, we meet CCOG.
CCOG,
Yeah.
sorry.
And actually, one of my towns is in NECOG. The Voluntown is in NECOG. But the Council of Governments meets, and we had, at times, we were doing every other week, we were having a COVID-specific meeting. So just so folks know, I mean, the first selectmen, the city managers, et cetera, the mayors, they were getting together as well. And again, it's looking at things collectively. What are we doing? How can we do things together? How can we make things consistent? What problems are you having in New London that are similar to the ones in Norwich? And are people accessing services enough? And are your long-term care facilities suffering in the way ours are? And I think that's really good because we've always heard Eastern Connecticut gets forgotten in many ways up in Hartford. And between our legislators and our first selectmen,
East of the river.
we do a heck of a job of making our voices heard now. And I think that's really important. There's only 5 COGs, I believe, in the state, and we're one of them. And Jim Butler runs ours, and they do a very good job of making sure our voice is heard.
Very good. All right. Griswold Parks and Rec, Youth and Family Services comments. Now, I don't feel clean on this. I feel a little dirty. Saying this one. We love Patrick.
That makes my day.
A little dirty there.
I did walk up.
Up to a year and a half ago, who the hell's Patrick?
No,
now he's a star.
I put.
Well, there is Patrick Star.
I did put $10 in the door down there as I was walking up the hill. So. Ryan does an excellent job, and again, it's another one where the Youth and Family Services, before he has events, he's always reaching out saying, "Has something changed? Is there specific guidance I should be following?" He's proactive, and that's what we ask for. Is he's concerned about the kids.
Yeah.
He wants to make sure the programming can happen. And the only way it can is if it's done the right way. So he's a model of what a Youth and Family Services should be and what the Recreation Department should be. And they've had just as many challenges as we've had or the schools have had. Am I overseen by Office of Early Childhood? Well, if I'm in the schools, am I overseen by the State Department of Ed? Do I have to deal with the Department of Public Health on this? Am I going through an executive order? That's the kind of stuff that a poor rec director is dealing with when they're trying to decide how to coordinate a program.
Sure.
Do my kids have to stand in hula hoops? Do they have to be 6 feet apart? Can they wear masks? Do they not have to wear masks? Are they indoors or outdoors? What's your preference? Do they have to have walls on the tent? Do they not have to? It sounds ridiculous, but that's the level of detail that we have when we coordinate all of these activities.
Sure.
All right. Well, I think we've covered quite a bit today.
So.
The last 45 minutes or so. So
I appreciate.
I appreciate you coming in.
No, and I appreciate very much that you asked because it's helpful to me. Lets me know what the questions are that you're receiving, and like I said, I can't always answer all of them or do a great job with them, but I'll take it back, and hopefully the next time I'll be able to do a better job.
I know I have forwarded questions to you, a couple, and you've done that. So once again, one of the things that I had put out before we started talking to Patrick is we're very interested here at SNSN to know what it is that you guys want to talk about as residents, whether it's what's going on in current events or there's just whatever. But we can't do that unless we know what is important to you. So, I can't even put it up on Facebook because you get some hee-haw jokester, they'll say, what's important to me? Let's see, Mr. Pibb or Dr. Pepper.
Well, the one thing one of the things though during COVID that I learned as far as the community, I got to know the communities much better. When we're driving to houses to give people vaccine, you start making the trek and realize that there's no good way to get here to there in most parts of our district.
Yeah.
But it allowed me to realize that, Jewett City is very different than parts of Griswold that are out by Preston or,
Sure.
there are people who live in a very rural way versus very urban way. And, there are businesses that are ones I had never even knew existed. And you have resources in the community that, are a draw, be it, you have an incredible golf course in town, you have incredible waterways in town that people take advantage of. While we're getting calls about COVID, we're also getting calls about the drawdown of Patchogue Pond. And, and then I get calls about Triple E and West Nile virus. And it's like amazing, all the different things. And, is Buttons going to be open this year? And am I going to be able to get my ice cream? And so to each person, what they want to know can be a little bit different, but it's always important to them. So I think that's the resource you provide to people is trying to be broad and let them realize that, Griswold's a big place and there's a lot of different things happening here. And, the Ryan Aubins and the events he's doing and the fact you have 2 different fire departments that are both dealing with 2 different issues all the time. And there's just a lot going on. And
I don't think people realize that until you just laid it out there, how many different cogs to the wheel.
Absolutely.
Yeah. So
the one thing you have that I found within the region, and this came up during COVID, the fact you have a consolidated school here where everything is on one campus is amazing. Other schools don't have that resource. It is amazing. And it's been a great resource to us. And that's why we've identified that as being a potential source for us for preparedness going forward. It's one of our sites where if we have clinics at a school campus, the high school's the
Yeah.
place that we're going to use. So the flow of traffic, the ability to have multiple events on the same campus at one time, the ability to reach out to families all in one location, all of that's been incredibly valuable. And Griswold has that as an advantage.
There is always something going on over there. You could drive by there any day of the year and you just kind of look over and there's something going on.
And I would tell you on the calls we have all the time, the borough is always represented too. So you have the borough warden on. It's a unique aspect, but again, it provides an extra level of support for all the activities in town. And, I know in many cases you're able to leverage a little bit of additional funding because of the borough in addition to the town. So there's a lot of things that are of value here that people sometimes forget.
Speaking of the borough, we have a t-shirt. It says Jewett City, Connecticut. It takes a village. Village is crossed out, and it says borough.
Nice.
How's that? Huh? That's a little.
Well, people don't know this story. So the reason that the Uncas Health District was originally able to form a district was because they were able to take the town of and city of Groton and call it two different towns, and that's how they made a district.
Oh,
So it's things like that where it's unique to Connecticut. How do you form a district when you have Groton and Groton? Well, you have a town and city of Groton, and then you have Groton, Long Point. And the first time I came to this area, I couldn't tell you where Danielson was or where Moosop was or where Egan. And when I went down to Fitchville, and and then people say nobody realizes that there's 3 post offices in the town of Sprague because they don't realize that Baltic, Hanover, and Versailles are 3 different villages all in the same town. So let's not tell anybody, so we keep getting all these additional things.
So there's that hoodie online. You can see the picture. I just put it up there. It takes the village/borough, Jewett City, Connecticut. There's America's only Jewett City as well. You can get these at snsnradio.com. It's and click on
commercial break.
They come with or without a mask, I believe. Is that correct?
With or without a mask. And people, I think we have to sell something because people think that, Mike, he just goes there and does it every day, and doesn't have to work.
So just so folks know, you can turn the hoodie around and essentially it operates as a mask.
As a mask.
So there you go. Another reason to buy it.
Brilliant. And then there's a picture of my puppies right there. That's Howie and Henry. For no particular reason other than they're just damn cute. All right. Thanks, Patrick. Thanks for coming down.
Thanks for coming
Absolutely.
All right. We will be back tomorrow morning once again as Patrick, you may be interested in this. You may not. Every Thursday is Psychic Thursday.
Oh, I knew it was coming because I'm a psychic.
He's a psychic. He knew it was happening. We have a psychic come in and answers your questions, and she'll tell you right out. She talks to dead people.
Hey, they're people too.
Yeah, they're people too. Don't hate on them. So that will be tomorrow morning, and then we'll have Josh Cingarelli from Channel 30 on Friday.
Oh, the weather guy.
Huh?
The weather guy.
Weather guy.
Oh,
Favorite weather person in the state of Connecticut.
And we're going to talk about like the winter season, or
that's cool.
like summer transitioning to fall.
Yeah.
And everything that goes along with it. So
and the
interestingly,
nice thing about it, he's local.
He's local.
He's local to the area.
He's the assistant fire chief in Lisbon.
His brother's the fire chief.
It's family affair.
Really?
All right, we'll see you tomorrow. Have a good day, everyone.
News this hour from townhall.com. I'm Greg Clugston in Washington. It's crunch time for President Biden and Democrats in Congress as they try to find a way forward on a massive tax and spend plan. There's pressure to trim back the